Good evening, mamas. These nighttime pregnancy stretching exercises is my secret weapon to sleeping better during pregnancy and settling baby into a good sleeping position. A specific routine inspired by top birth experts in the world to prevent leg cramps and common pregnancy aches and pains by loosening the ligaments and balancing muscles throughout the body. My personal bedtime stretch routine can easily be done at your bedside, a great way to wind down in an easy 4-minute flow. Tmj Release. Clench your molars and locate the big muscles for chewing. Then relax your jaw and press 2 fingers into the big jaw muscles and hold. A tight jaw is a tight pelvic floor. Neck stretch. Lift your chin higher than the back of your skull, then come back to center. Turn your chin to the right, then bring back to center, then turn your chin to the left and repeat. Lower your chin, lifting the back of your skull and turning to your right, then center and repeat for left side. This helps balance an overstretched neck developed from long periods of looking down habits. Behind the back hand clasp. With ribs down and over hips, gently swing your arms behind you. Clasp your hands together and straighten your arms. Become aware of your inner shoulder blades moving deeper into your back. Thoracic extensions can improve lower back and neck pain contributed by slouched postures. Calf hamstring stretch. Step the ball of your foot onto a rolled towel or edge of your bed. Make sure your heel is grounded on the floor. Stand straight, but with a slight bend in the knees. This relieves and prevents leg cramps while also gives length to your hamstrings so your sacrum and buttocks muscles are more mobile. Pelvic tilt. Start with your hands under your shoulders, knees under your hips. Focus on your lower back. Lift your lower back, then flatten your back again. Your back goes from straight to then arches up. This stretch loosens the hips and releases the sacrum, which relaxes the lower back and soothes an achy back at the end of a long day, especially helpful if you sit with poor posture for long periods of time. Belly pumps and diaphragmatic breathing. With ribs over hips, take a deep diaphragm breath, as if widening the back of your rib cage. Then exhale and hug your baby by pumping your side transverse abdominal muscles. This safely strengthens your core and pelvic floor while also improving digestion. End with a few diaphragm breaths to slow the mind, de-stress, and expel built-up toxins for a better night's sleep during pregnancy. Modified open knee chest. Place your forearms and knees on the bed, knees about hip width apart. Then aligning shoulders up over elbows, rest your head on your arms. Being careful to not rib flare, sink into the stretch. This stretch potentially allows baby to get into a good head down position for the night by untwisting any lower uterine ligaments that may be developed by twisted posture habits, such as crossing your legs. Coming out of this stretch, align your body into an upright kneel to allow those temporarily lengthened ligaments to set the uterus in alignment with the pelvis. In late pregnancy, with a head down baby, do engagement activities first, like the side-lying release. And remember, balance before gravity, because you don't want to do an open knee chest when an already head-down baby is not engaged and floating high, or if you have an abundance of amniotic fluid or loose abdominal tone, which could all risk the baby flipping breech. It's always a good idea to consult with your care provider before starting any exercise program when you're expecting. Your doctor may have certain restrictions for you, especially if you are at risk for preterm labor or have placenta previa, high blood pressure, or were prescribed bed rest.